Welcome back to Focus on Health. In case you're joining us right now, we are getting a very interesting and engaging conversation on Men's Health Month from Daktari. And Daktari has been telling us a lot about how to create awareness on Men's Health Month. Keep notifying us and even hitting us up on our social media platforms at KUTV Focus on Health on Facebook and on YouTube, and also Health Focus on Instagram, and we'll get back to you on all your queries and comments. So Daktari, maybe now we could pick it up from where we left. During the break, we're talking about NHIF, and maybe now we could link it even to the government. So the government is trying to maybe realize, the men's health, progressively. What are some of the challenges that we have, or even gaps that you've noticed in the effectiveness?
Yes, there are gaps that we need to put emphasis on. Is the formal sector, the employer pays for NHIF. The informal sector, then people need to pay for themselves. Then there are a lot of people who are not paying NHIF for themselves. So we need mechanisms in place, even if it's through the county government or whichever form of government, to ensure that each and every citizen is covered by NHIF so that they can go to any healthcare facility. Then we also need to have healthcare facilities that are equipped to be able to provide wellness programs for these people. And that's why, for example, Bliss, we are in 42 counties in this country, and we have all the necessary diagnostics, not only to test the disease itself, even to do screening. So sometimes you may find that someone is in need of this healthcare and visits a health facility somewhere. And then he has to be referred to another health facility which is far away, and then give up and then go back. And the disease continues to progress from stage 1, stage 2. When it's in stage 3, then they are carried. The man is carried now to the referral hospital, whereby the disease is already advanced. So I'm encouraging that even the government to also improve on the diagnostics in the rural areas.
So Daktari, maybe now you could take us through the healthy living ways that men should adopt.
One of the health ways of living is, number 1, eating healthy. And number 2 is physical fitness, physical activity. At least 30 minutes per day, if you are healthy, of exercise. Otherwise, 1 hour. And if you are intending to lose weight, you need to go up to 90 minutes, 1.5 hours. The other thing is be smoke-free. Smoking increases the risk of death from heart disease threefold. It also increases the risk of having other lung diseases like pneumonia, bronchitis, bronchiectasis, and even lung cancer. Smoking also increases other diseases, like the risk of other diseases like hypertension. Then, as I've said previously, you need to manage your stress. Life is very stressful. We have to live. We are here to live. So you need to manage your stress. The other is that you need to know yourself and manage yourself. How do we know yourself? If your father had diabetes or your mother had diabetes, you have higher chances that you are likely to develop diabetes. So you need to know your risk factors so that you manage them. If you are one of your parents or both had hypertension or diabetes, for example, hypertension, then you need to constantly be taking your blood pressure so that you can modify your diet in times. For example, stop taking salt, low fat, all that. So you need to know yourself. Then men need to be safe. They live a risky life, but they need to be safe at home, on the road when they are driving, at workplace, and even in social places when they go. Yeah. So leave your social places in time when there is, you don't need to fight with the police for curfew, then you are clubbed. Then if you have, in a social place you have drunk, please call a taxi driver, call your wife, call your brother. Don't continue with the risky behaviors. Then we need to speak up. Very many men have symptoms, but because they feel they are men, then they keep those symptoms to themselves. They don't even disclose to their wives. They don't disclose to their brothers, their son, until it's very late is when the man will tell you, you know, I have been having problems of passing urine for the last 2 years. So even though we say big boys don't cry, but speaking up is not crying. You are just taking care of your health. So that is what I would advise my fellow men.
Very interesting, Dr. So you've taken us through the men's health, and even we have the awareness and the checkups and everything, and even the ways to live healthy. Tell us, what are some of the challenges that we face in implementing these healthy living ways?
Achieving healthy ways of living, one, it has to be yourself and you practice it. So you must have the initiative. Whereby if you are working, for example, those who are working and they are getting to the office at 8, you need to have the habit of waking up maybe at 5. You exercise for some time, for that minutes of 1 hour, then take your breakfast, and you go, so that both you have good health meals and health physical activity. So engagement sometimes acts as a barrier. You find someone is in the office from 7 until 9 p.m. He can only eat and sleep. Wake up, work, eat and sleep. People need to create time. And visit your doctor. You have any other problem, go and visit your doctor. It is your birthday. At Breeze we are saying, on your birthday, make sure the first thing before you cut the cake, you go and visit your doctor so that you can have it. Then to address other barriers, for example, at Bliss, what we have done is we have chronic care programs. We run the biggest network of chronic disease management: hypertension, diabetic, heart disease, arthritis, convulsive, asthma, all those. We have about 21,000 patients we follow on every other month. So you need to enroll to where people will remind you. For us at Breeze, we remind you, you and drugs, you need to come and take them. If you are not able to come and take them, we have Breeze at home. We bring those drugs to you. If you are not able to visit the medical center for any other reason, we can send a nurse or a doctor and samples can be taken. Then they are tested and then your results are given. So that then you also do not want very elderly people leaving their comforts or coming to hospitals and they queue for long. So that's how we have this CDM, we call it CDM, chronic disease management, at the same time then Bliss at home. And for example, particularly for this month, then we have Bliss Wellness. You don't have to be sick, as I have said. We don't take cars to garage because they have broken down. By the time they have broken down on Uhuru Highway, then you have to be there. You'll be clobbered there or you stay there, it is raining on you there. So we take them when they have reached a certain mileage. Take care of your health the way you take care of your car or the way you take care of your precious elements that you have in your life. It is this life. You don't have another life.
Okay, so maybe Dr. we could have your parting shot regarding men's health generally to the public. What can you tell them?
So generally, men fear visiting doctors. So I would encourage each one of you, maybe this is your brother, you have a brother, you have your husband, you have your father, you have your young. Please ensure you call them today. Tell them that this is Men's Health Month. Let them visit their doctor. Bliss is in 42 counties. Come and we shall give you the best wellness program, screening program, and the best treatment at very affordable rates.
Thank you so much, Dr. It's been quite an engaging session, and even looking forward to having you join us for more and more. So there you have it from Dr. Let us stop the fear of visiting doctors. Let us create awareness on men's health. And just as much as you love your car, just as much as you take it for servicing, let us also love our bodies. Let us create awareness on men's health, do regular checkups, and remember that your wellness is of top-notch priority. I've been your host, Bari Michelle. We love your feedback on our social media platforms. Keep hitting us up on Facebook and also on YouTube at KUTV Focus on Health and Health Focus on Instagram. Until next time, stay safe and stay healthy. I will leave you with the Health You segment.